He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Hey, folks, we're glad you're here. It's the Stay Off My Operating Table podcast with Dr. Philip Ovadia. We are joined today by Roxana Soetebeer. I had to work to make sure I got her name pronounced correctly. Roxana, welcome.
Thank you.
Phil, I did a little bit of research. Interesting story, but I don't want to steal anybody's thunder. So I'm just going to sit back and let the two of you do your thing.
Yeah, definitely. I have now known Roxana for at least a couple of years. We oftentimes run into each other at low carb metabolic conferences and kind of been following her journey along, which is a great journey that we definitely want people to hear about. And she's been getting increasingly involved in the kind of community, working behind the scenes on the conferences. And even as we're going to talk about, we'll be coming out in front of the scenes, getting up on stage in a conference here upcoming. We'll get into all of that. But Roxana, why don't you introduce yourself to our audience and kind of give the intro to your story, how you were led to metabolic health?
If you had asked me 6 years ago if I would be getting better or healthier or would get off insulin, for example, I would have said, no way, I tried everything. Weight Watchers, like everything, calorie restriction, just nothing worked. And when you try everything, at some point you lose hope. But then my diabetes got so bad, I had a week of high sugar levels around the 400s. And I was feeling dazed. I knew my liver was doing badly. I had NASH, which is inflamed fatty liver, like one step short of cirrhosis. And so with that, sugar levels that high, I went into my son's room and asked him for short-acting insulin. I was already on insulin, but long-acting. So I asked him for his Humalog. And then I calculated in my weary head, like, okay, I need so and so many units to bring my sugar down. And I injected it. And then I thought, oh, okay, this wasn't a good idea. So I called a friend in Germany. He was in his morning commute. It was in the middle of the night. And he said, I guess your calculations are good, but stay awake. Watch Stephen Phinney to keep you awake. And check your sugar every half hour. So I watched Stephen Phinney, and I thought, that's the answer. I mean, from complete hopelessness to suddenly knowing, this I have to do. So I decided.
You watched
what? Dr. Stephen Phinney.
Oh,
so he's
okay.
one of the very early adopters of the ketogenic diet. And it was a 2-hour lecture, and everything made sense. How keto works, why it works, the science behind it. Like, it was an amazing lecture. And then the next day I told my husband, like, I'm going to start keto. And he said, like, no, it's dangerous, because that's what he knew. That's what I thought too. But I watched the video. So I got the okay from a doctor. And like 5.5 years or so, 6 years later, now I'm here. I'm off insulin. I'm off most medications. My thyroid isn't doing well, but that's more like a replacement than a prescription. And yeah, because I saw what this can do, I thought, okay, I have to help others. So I made my Facebook group and I got involved in the space. I got to know all the great people.
So how long had you been diabetic up until that point? And just so we can be clear, you're type 2 diabetic.
Yes. So my son's type 1. That's why he had insulin, fast-acting insulin. I'm type 2. I was on 50 units long-acting before my sugar just went off the rockers. And I was diabetic for 3-4 years, but with a very fast progression. And in fact, so fast that I thought it was type 1. It was in the family. With Hashimoto, could have been, but wasn't. It's type 2.
And, maybe let's go back, talk about what it was like being diagnosed with type 2 diabetes initially.
I honestly didn't think much of it. I was diagnosed with rheumatoid arthritis in my late 20s. And I was told, you have to be a good patient or else you're going to get worse and you're not going to be able to. You see, I don't look like rheumatoid arthritis, but I was a very obedient patient. And so as I got sicker, when I got kidney disease and NASH, I just didn't think twice.
You said that a couple of times. What's NASH?
NASH is non-alcoholic steatohepatitis. It's first you have fatty liver not from alcohol, so non-alcoholic fatty liver. They have a new acronym now, which I don't know.
Yeah,
And
they
then
changed the letters a couple more times, but NASH is one of the terms we used to use for it.
Method or something.
Yeah.
And then when the liver becomes inflamed, that's not good because there's no treatment for that. And so I had a biopsy done because my markers were really bad, and they confirmed it was NASH, so inflamed fatty liver. And the next step up is cirrhosis.
So NASH is fatty liver or
inflamed fatty liver?
Kind of an advanced form of it.
Advanced form of fatty liver.
Yeah.
Yeah. So it's not good because there's no medication.
I lost a friend to fatty liver, and I'm particularly.
It all starts in the liver. That's where people usually get sick first, but most people don't know because there's no pain in the liver.
Yeah. So what I'm hearing is, you had kind of a series of diagnoses that you kind of went through, and you were, following the advice that your doctors were giving you. And yet it sounds like you were kind of just getting sicker and sicker.
Yeah. They sent me to a dietitian. And then I told her what I knew. And then she said, "Oh, you know everything." And I said, "Yes, I do, but it's not helping." And then when the doctor said, "Now you have to be on insulin, it's going to be long acting and probably short, like in the near future on mealtime insulin, short acting." And I just thought, okay, so this is the pen. How many units I'm going to inject it? I was used to injecting it, not to myself, but to my son. And so it was nothing, it didn't even rattle me. It was just, here's my diagnosis, here's the pill, I'm just going to go along, and I'm going to be a good patient.
Yeah, I mean, and that does speak a lot about sort of our medical attitude these days, that these things are they just happen, right? And, we can treat them. And, it's kind of, in a lot of ways, obviously these are very serious diseases, but we kind of don't recognize how serious they are anymore. We sort of minimize them because we have treatments for them, right? And so I think a lot of times, unfortunately, patients almost patients don't get scared enough, I guess I would put it as, when these things happen, because, in my mind, the correct response should be, "Oh my God, I have a serious disease. Why did this happen and what can I do about it?" And instead, what I see in the medical system, and it sounds like what you experienced, it's more, yeah, this is a very common thing and here's the treatment for it. And you really don't have to think about, why it happened. Just, we have a treatment for it and we'll take care of it.
Yeah, there is a pill for every ill. It really didn't rattle me until that week where my sugar level just went out of control. That's when I thought, okay, if I'm continuing like this, I'm going to be dead in 2 years. And I'm not, and I don't know if I would have been, I don't know. But that rattled me. I have people in my group that come in and say, my doctor said I could be insulin resistant. What do I need to do? I'm here to change. And then those are like the very early people. And then there are people in diabetes groups who say, "Oh, cake is life, and I want to have that little bit of enjoyment." And they get their limbs amputated and they don't change. So there's like this whole spectrum, and I just caught it in time. I don't think I would have had much more time before I could not turn it around.
Yeah. And, quite fortuitous, I guess, that you had that conversation with your friend and they directed you to, Dr. Phinney's work. So talk a little bit what that was like. So you see this video from Dr. Phinney and you decide to go keto, based on it. What were you thinking at that time? Because you're obviously, you had been working with your doctors for many years and no one had ever mentioned keto to you before. What were your thoughts when you kind of heard Dr. Phinney talking about how we can reverse type 2 diabetes with a low carbohydrate diet.
I did actually have one conversation about keto, but not for myself, for someone else with epilepsy. And I was told, don't even bother. It's a non-palatable diet, and you want him to just have a normal life. And so I was exposed to it. And then before I heard about Dr. Phinney, I talked to someone online and told him, like, okay, what do I do? My liver is doing really poorly. Can I do keto? And that conversation somehow ended nowhere. I was concerned about my liver, but the moment I saw that video, I wasn't. Or I don't know, maybe I forgot about it, but it was not on my mind. On my mind was just, I can do this, and this will get me better. I didn't even feel that anger that I feel now. I'm incredibly angry with where people got me, that even that I ended up being. That was not necessary. I could have adopted the diet 10 years earlier, and I would have been much better off. But at that point, I'm not going to say I was just thinking about myself. That doesn't sound right. But you know what I mean. I was just focusing on getting better. That was actually just before COVID. So I then had all the time to concentrate on myself because we were all locked up. I mean, that's kind of my silver lining, I guess.
That's really kind of cool. You had time to concentrate on yourself because we were all locked up.
Yeah.
This is completely unrelated, but I just watched an interview on Bridget Fettis's show where she was interviewing a fellow addict, and they were talking about what it was like to be addicts and how all the best intentions in the world that would work with non-addict people are completely the wrong thing for addicts. And he spent 6 months in jail for what he did. And he said it was the best thing that ever happened to me. I'm tremendously grateful that I did that jail time. And it's good to hear of a positive thing that came out of that kind of isolation. It's possible that there are people listening to this who haven't heard any of our other episodes, and it would just be really cool to talk through. I would just take 2 or 3 minutes
Mhm.
to talk through what it's like to be a type 2 diabetic, what it's like to start on the road to reversing it, and maybe some of the experiences of now having reversed it and what it's like to communicate with other folks who still have type 2 diabetes.
I do kind of feel like even though I had diabetes, I didn't pay much attention to it. I just had it. I
Right.
knew it. I knew about the complications, also like through my son because he was diagnosed a long time ago. And I knew all that. It was in the back of my head. But you know how you can't just have this glooming feeling of despair over you all the time. I was just like pushing it out. Not that I wasn't trying not to think about it, I was trying not to think about it, but I just didn't. I didn't think about it day to day. I wouldn't go somewhere and say, hey, my name's Roxana, I'm diabetic. Or when
Yeah.
now I say, hey, my name's Roxana, I used to be diabetic. So that's how a lot of conversations now start. But back then I didn't adjust my diet. I didn't
You
even
just
think I
you just
had to.
shot up insulin.
Yep. I checked my sugar every now and then, and not even that on a regular basis. And not until my sugar levels really went out of control. And then when I went on keto, I checked them all the time, of course, because I didn't want to go low.
Right.
But yeah, but as far as being diabetic, it wasn't like a type 1 diabetic who has to count carbs and take care. It's a constant battle. It wasn't for me because I just didn't engage in it, I guess.
I understand.
And
I
and maybe
have,
also that's why my sugar levels went so high because it wasn't good what I was
yeah,
doing.
yeah, exactly. I've got a good friend who's that's, he has developed type 2 diabetes because of, quite frankly, just lifestyle, because it's a lifestyle disease.
It is.
And he treats it like, I don't know, I've got dandruff. Like it's
Yeah,
just not that. But I never heard of anybody who suffered amputations, blindness, or death from dandruff. So to
yeah.
me, it's like a big deal. So now you're on that road back. Physiologically, how's it feel in your body to start reversing it? I don't mean now, but I mean
Back
you've
then.
you've lived with it for a while, and now you're starting to reverse it. What's that? What's the experience?
So because of all the restrictions I had since my late 20s it was diagnosed as rheumatoid arthritis. Apparently
Oh,
it's
I want to ask about that too. So please,
inflammatory arthritis, but
yeah.
I was always sick. I always thought, okay, here's all the things I can no longer do. Here's all the things I'm just going to settle into what I can do. I put the victim coat on and I didn't do much. I wasn't fun. I wasn't happy. I was just um, doing what I had to do. It was so, yeah, with then starting keto, all of a sudden I did feel different. So I started almost like waking up. I remember when I was young, my eyes were like bright. I captured everything. I was everywhere. I did everything. I really enjoyed life. And then I didn't. And now I enjoy life again. So that switch from starting to eating keto to feeling completely different, that was almost like light switch was flipped. That happened pretty fast. And I guess because my sugar levels normalized basically almost overnight.
Yeah, that's, interesting to hear you say that, right? Because I mean, the interactions that I've had with you, obviously post going on keto, you're one of the happiest people I know, and it would be hard to imagine, you not happy, but it sounds like you were not happy. So we've had a number of people on this show who have undergone transformations with low carb diets and keto. You're the first type 2 diabetic that we're going to get kind of deep on this with. What was it? So starting to implement the ketogenic diet when, thinking back to when you were starting it, maybe just talk a little bit about what that was like, how you kind of figured out, what to do, because it's one thing to just say, okay, ketogenic diet, and then it's okay, what is that? What do I actually eat? How do I do this? And maybe just talk a little bit about sort of the early part of that process and what it was like for you, how you were managing your medications, those types of things.
In regards to blood sugar medication, the insulin, I was on 50 units and I slept on one of those Libras to see how my sugar would go. Libre, that's a CGM. You wear it
Okay.
for 2 weeks and then it shows you on your phone what your sugar is doing. Now, on long acting, because you inject that once daily, it's a little harder to say, okay, I cannot take back what I already injected. But what really worked was I just cut it in half right off the bat, and I made that decision. I didn't talk to my doctor about that, and I don't do that if you don't feel safe doing that. Anyone, but I did feel safe. I didn't know much about keto. I knew no grains, no sugar, no high carb fruit, no high carb vegetables. With no grains, of course, no flour, no bread, no. I didn't. Most of the like the processed food in the store fell through because most of it has sugar or high fructose corn syrup, but it was still dirty keto. I bought all these keto treats, keto bars, keto chocolate, everything I could get my hand on to make it easier. And now complicating this issue a little is that I'm like a true sugar addict, like as addicted as they come. And so these replacements really worked for me. I made fat bombs, all that. I wrote down every carb I ate into a carb manager program, and I just stayed under 20 grams, and that was it. I didn't even know about seed oils. I didn't know about all these things that you learn one after the other. I didn't do that. Just no sugar, no grains, under 20 grams of carbs. And to do that, I couldn't eat high carb fruit or high carb veggies. And that was it. I didn't fast. I thought actually that was stupid. And I was happy. I had actually a chocolate mug cake every night, a keto chocolate mug cake. And it was delicious, and I was looking forward to that. And now I don't, because it's bothersome to make, and I just don't care about it much anymore. But
Yeah.
in the beginning, that was perfect for me because it kept me busy, it kept me satiated, and it distracted me from my sugar addiction.
And
Oh,
you said you have a son who's a type 1 diabetic, and your husband, it sounds, was kind of skeptical about this to start with. Maybe talk a little bit about, your interactions with them during this time and what they were doing and thinking and what they were seeing in you.
So I made him promise to talk to my doctor first. And I had like my fingers like this behind my back. I admit that. But I made him, and then I actually did talk to my doctor first. And she was like, she thought, yeah, do it. This is good. And they were kind of, after she said yes, they were accepting. And the only thing I asked them is, because we used to eat snack food at night, and I asked them, don't eat here in the living room when I'm here. Go in another room or just don't eat, because I couldn't eat late. I had my 3 meals. I might have, yeah, I had that chocolate cake, but I wasn't going to munch on chocolate chips or anything else all night long. That was pretty much it. And they saw the difference that it made in me. They saw how I felt better, and they saw how I was very puffy too because of all the medications. So they saw that go down. They saw me lose weight. They saw me be cheerier. So they really were on my side. They wouldn't do it, no, but they supported me.
Great. And you start seeing improvements in your diabetes, you start reducing your insulin. Now, you mentioned that you had a couple other diagnoses at that point. You had arthritis, rheumatoid arthritis, and some thyroid stuff, maybe. So, what happened with that as your diabetes was improving?
So the rheumatoid arthritis diagnosis turned out to be a misdiagnosis, but actually, I'm not sure. From being on Imuran at a very high dose. So I
what
was on
is this?
300 milligrams a day, Imuran. It's an immune suppressant. For example, when someone has a kidney replacement, or a kidney replacement, kidney
Transplant.
transplant, yeah, they give them Imuran, and I was on that dose, at the same dose they give to kidney transplant recipients. And that was actually the initial high dose, and it was supposed to be tapered down. And I forgot. So 10 years I took that medication at that high dose. I don't think that was good for my liver either. I might have expedited my troubles. I was able to get actually off that. And for a year, I didn't need anything, but these inflammations did return. I'm not sure why. I'm still trying to figure that out. So my journey isn't, I guess this journey doesn't have a destination. It's always a journey. But I'm fine with that. I had stage 3A chronic kidney disease. And interestingly, no one told me. But my markers, and you can just feed those markers into ChatGPT and it'll tell you, okay, that's stage 3A. That resolved. The diabetes reversed.
Oh,
And yeah, GERD.
I just resolved.
Yes, I don't need pantoprazole. No, what's that, the medication? It was some
That's
proton
for the
pump
GERD.
inhibitor.
Yeah.
Yeah, and actually taking that long term makes GERD even worse. I didn't know that. Now I know. And you don't digest your food right. So I didn't know that. Now I know. I learned so much in the past 5.5 years or so.
Phil, I
Right.
want to jump in here before I forget this. Roxana talked about she was diagnosed with, as it turns out wrongly, rheumatoid arthritis. Why is it that, and maybe I'm perceiving this wrong, but it seems like rheumatoid arthritis and diabetes show up in the same place in the same people a lot? Are they two different things, or is the same thing going on expressing itself two different ways? Or do you know? I don't
I
put on
mean,
the
I would
spot,
say,
but
yeah, they are both definitely associated with metabolic disease, So being insulin resistant increases your risk of both of these disorders. Rheumatoid arthritis is an autoimmune inflammatory condition. Type 2 diabetes is, just advanced insulin resistance, essentially. There is a definite association between the two. And, there's it seems that once you have one autoimmune disorder, you're more prone to other autoimmune disorders. They do tend to cluster together.
I guess that's maybe what I was wondering. Is this really more just downstream effects of autoimmune disorder that
Yeah,
really the
too.
Yeah,
the
Roxana
Hashimoto.
mentioned she has her Hashimoto's, which is autoimmune thyroid. The role that autoimmune disease plays in type 2 diabetes, I would say, is not fully understood. And I think we're learning more about this. And there are certainly also, we're learning that a lot of people that are diagnosed with type 2 diabetes, which, you could think of it as a not autoimmune. Type 1 diabetes is actually an autoimmune disorder. Type 2 is thought not to be autoimmune. And there are now a lot of people that we see that they're diagnosed as type 2, but they do have an autoimmune component to it, at least. And we can test for antibodies against insulin and against the pancreas. And that turns out when you do that on type 2 diabetics, you find that a not insignificant portion of them actually do have an autoimmune component to their type 2 diabetes. Lots of reasons why those things all go together. And, Roxana's experience of one gets better and the other gets better, together is also, I would say, not unusual these days.
People, like when you look at them, they look generally unhealthy. So most people are metabolically sick. And then that's my theory, these issues cluster. It's also like less hair, which I have. And yeah, okay, but that's like different, I think.
I don't know. I'd love to think this is reversible. This would be so awesome.
Yeah, I'm still waiting for that, unfortunately, as well. But yeah, and you can also think of it, right, as, one of these things is, kind of weakening the body. And, the body is putting their resources towards fighting off this, right? And so it allows maybe the immune system is more vulnerable, and lots of kind of theories around that as well. All right, so you do this, you get these great results, you're able to ultimately get off of your insulin, and you've reversed your diabetes, and you're off your medication for your arthritis. And so it sounds like we're doing a lot better. And then I guess, take us to, all right, and why did you then decide, it's one thing to do that for yourself, and that's great. And then you decide to, that you want to help other people that are trying to do the same. Talk about that, and then kind of talk about where that led you.
Yeah, I was just amazed by the power of food and by the power of nutrition. I think there's definitely a genetic component. I'm just more susceptible to certain things like maybe even autoimmunity and getting obese easier or getting diabetes easier than other people. But the power of food just amazed me. And so I was in several keto groups, and I thought they're all not talking about the root cause. So I want to do that. I founded a group. It's called Reversing Insulin Resistance. And then we got the first 10 members, 100. And then every 1,000 members we like celebrated. And now there are over 20,000 members in that group. And it was a lot of fun. Like on Facebook, there is a power admin group. That's a Facebook curated group. And they then give you training for community management and these things. And they said, diversify. Okay, so here's my Twitter account now, and my Instagram, and Twitter, or X now, is so much fun. But in order to help people, I also needed to learn more. I couldn't just rely on what other influencers were saying. I had to actually dig into the science behind why keto works, and that it's not unhealthy. It's not a fad diet, what people will say. And so I approached, on one of these conferences, Doug Reynolds talked about the SMHP and becoming a metabolic health practitioner. And I said, okay, how do I do this? Because I wanted that. And I took the courses, and then I became a metabolic health practitioner. And then my bestie, Tia Reed, said, oh, there's this other course you can do. It's a nutrition network practitioner. So I did that. And I had to actually, the first time in, I don't know, 30, 40 years, I had to write essays and actually learn and be tested on that knowledge. And then through the Dr. Berry community, I also proceeded to do the Primal Health Coach training, which I got the Primal Health Coach, the Primal Fitness Coach, and now I'm starting next week or so, I'm starting with a Master Coach. This is an incredibly fun story because the more you know that you don't know. And I'm constantly learning. Even this conference that we just went to in Boca, I learned new things. It's amazing.
This is not necessarily something that the rest of our audience is going to say, oh, yeah, I totally needed to know that. But it sounds you're somebody who just loves learning.
hmm
Accurate? Yes. That didn't require a great deal of insight on my part. However, before you got well, was that love of learning, was it there before you got sick? Did it get muted when you weren't feeling good? Did
No, it
was
was
there a
still there.
relationship there?
I kind of have a new thing that I want to learn. Like I had to design a website for my company. And so I bought the program, Dreamweaver, and it came with a book this thick, and just sat down and read through the book. And then I did the website. And then I had to do an instruction video. So I bought Final Cut Pro and I learned, like, got a course. Like, I don't know, 20, 30 hours. I did those hours. Then I did the instruction. I really love learning. I have to say, I would have probably done better or learned faster if my mind was working better. But now everything just clicks into place.
That was my follow-up question was a lot of folks talk about brain fog clearing up.
hmm
I'll confess, I don't think that's something I've ever struggled with, but maybe I'm in the midst of it and don't know. I don't know. I eat pretty well. Did you experience a mental clarity,
Yes.
a restoration of mental clarity?
Absolutely. It's almost the way I perceive everything around me is just so much more intense. It's almost sometimes a little too much, I guess, gotta say, like really loud noises that I don't enjoy that. But no, I just pick out things that aren't right. I pay attention. I also memorize stuff where other people say, like, how do you remember all that? I don't know. That wasn't before. And brain fog could be best described as a fuzzy feeling. You want to concentrate on something, but you really can. It's almost these 3D images when you look at them and you have to relax your
Yeah.
eyes to see them pop out. And you try and it just won't pop. And with the brain fog gone, you just look at them and the image comes into focus right away.
Were you aware that you were walking around in a fog?
Yes, because I very much remember how I was when I was 25, before I was first diagnosed. I very much remember that, and I very much mourned that. And I thought the world is so unfair. Like, why me? I
Okay.
mourned everything I couldn't do. And that kind of switched now to focusing on everything I can do. I think that makes people happier anyway, when they focus on what they can do, because there's
Right.
so much I can do. When I was like really big, over 300 pounds, I took a very hard fall and I hurt my hip. So I cannot walk long distances. And now I can say, oh, I can't walk long distances. I can't go on walks. I can do other things. Actually, the elliptical, oddly enough, that works.
All right.
Oh, yeah,
Fascinating.
one more thing. Fatigue also comes into play here. So it's not just the brain fog where you have a hard time concentrating or staying on task. The fatigue also makes it very difficult. And the fatigue, I'm guessing, comes mostly from the liver. It's the pain of the liver. That's gone
Fatigue is the
too.
pain of the liver.
Good way to think about that.
I've never heard anybody say that. That may be, is that original with you?
No, I wish. I mean,
Too
oh, of
bad.
course it is. No, it isn't.
You heard it here first, folks. Okay.
Yes,
Yeah.
breaking news here. So one of the other, kind of interesting aspects of all this that you've, been talking about more, and you're actually going to be giving a talk about this at another conference in a few weeks here as we're recording this, is the sugar addiction part of it. And you mentioned before, that you recognized you were a sugar addict. Go into that a little bit. Talk about why you think that, what are the sort of the indicators, and, how people who are listening to this, might start to recognize that they too might be sugar addicts. And then we'll talk a little bit about maybe what you can do about it if you do recognize that.
I think the easiest test to find out whether you are a sugar addict or not is to not eat sugar and see how you feel.
Huh.
If you don't eat sugar and a week later you're just fine and say, I'm just not eating sugar, you're not a sugar addict. That if you compare that to make the comparison with alcohol, and if someone goes to a party and drinks, maybe a few too many, and then they go back to work and the next week and they don't go party, they're fine. They're not addicts. They are kind of social users. And that's a lot of people are social sugar users. And then there's people who are harmful users. They eat too much and they get sick, but they're still not addicts. But those who cannot go without, same with alcohol, if you just can't even function without, those are the addicts. So a simple tip, just don't eat sugar, see how you feel. And most people, I think, intuitively know whether they are sugar addicts or not. And they don't really want to admit it, because admitting it means you have to do something. And if you don't, then that's a real conflict.
Yeah, and it's also, interesting because, when we think about other addictions, right? We oftentimes talk about addictions for, behaviors or substances that are kind of, a little bit shunned in society, right? Or people recognize these are clearly negative behaviors when we're talking about, other drugs or gambling or, whatever it might be. But, sugar is just ubiquitous in our society. And even more so, right? Alcohol might be the closest thing to it, but I think it makes it harder for people to recognize that they're sugar addicts because sugar is everywhere. And a lot of people don't even realize, to the degree that they're consuming sugar. And so they may not immediately kind of fixate on it, right? When you're drinking alcohol, you're drinking alcohol, right? It's not hidden in other stuff. But sugar is hidden in, so many of the foods that people eat. And I'll put foods in quote here, but
food products.
Yeah, food products that people eat. And so they may not immediately associate, they're eating that food, it's the sugar that kind of keeps them coming back.
Yeah. And it's not just the sugar. I will take that one step further. It's the ultra-processed foods. So these foods are really designed in labs to make people overeat. And then they get sick. And I mean, if you want to sell food and there's only a certain amount of food that's going to be eaten if people eat healthy, if you want to increase those sales, you have to make people eat more. And that's what you do with ultra-processed foods. And that's actually sugar addiction, ultra-processed foods. That's going to be the topic of my talk. It's called the sweet trap, sugar addiction from my perspective. And I lived it. I know what I had to do to give up sugar. And it's not easy. There are certain steps you can do to help you overcome that. But overcoming addiction is a bit trickier than, let's say, reversing diabetes, because addiction really is a chronic disease. I would say type 2 diabetes is not a chronic disease. It's not chronic progressive, like my doctor said. This is a chronic progressive disease and you're going to get worse and worse. No, because you couldn't reverse it if it was, or put it in remission, if people want to be nitpicky about the word. But addiction is chronic, but the brain actually can heal. And in my case, I'm just not obsessing about sugar. I'm not.
Yeah, talk about that a little bit. I mean, do you think that we should be kind of viewing sugar addiction and managing it, in similar ways to, again, these other addictions? Should we have the 12-step programs around it?
Yes.
Should people talk about how long they've been sober from sugar?
I mean, this is actually something that will help. I didn't do that, but that's something that will help. I think the first step is for the regulatory, whoever decides that sugar is a substance of abuse. It's not acknowledged as a substance of abuse. And as long as it's not, it's really going to be difficult to tell people you are a sugar addict. Because on social media, people tell me, are you eating sugar full, bowls full of sugar? No, I wasn't doing that. Who does that? But I was still a sugar addict. And then, oh, you don't know what addiction is because you're not a heroin addict. Actually, I was. But oh no, this sounds bad. I was on OxyContin for arthritis pain to manage the pain. And OxyContin is synthetic heroin. And
Yeah.
between doses, I had this withdrawal roller coaster. It was really bad. It was really bad. And getting off OxyContin was also like one of these steps. So I have my journey with addiction, and sugar is just one of them. I think sugar is probably for most people the earliest addiction that they have.
Yeah, that's something else kind of particularly, I guess, nefarious about sugar. And I've seen, I can't remember who on social media kind of talk about this, right? You know, we don't go
I
giving
do.
alcohol and heroin to, you know, to kids, right? But we pump them full of sugar. I mean, almost from birth in a lot of cases. You look at some of the baby formulas and some of them, you know, are the sugar content there, but and then, you know, first foods are oftentimes fairly high in sugar. Again, it's an interesting perspective. What so how do you view that as playing into, you know, all of this? And for, you know, people that are out there and they're trying to reverse their type 2 diabetes, you know, how does something like the, you know, a sugar addiction kind of play into that? And how should people be thinking about that?
So as far as it's like two things that happen at the same time. While I was eating keto, I felt less compelled to eat sweets. I still had my chocolate cake, but I didn't feel as compelled to stop at every gas station and buy something and just put
Hmm.
something in my mouth all the time. And because I was actually, for the first time in my life, experiencing satiety. So that's one thing. The diabetes thing, yeah, it happened at the same time. Actually, my diabetes getting off insulin was just not just keto. I also had to implement intermittent fasting. So that was, but then like within 2 weeks off insulin. For the sugar addiction, there are certain things you can do being satiated, replacements, if you can do them. Little steps. Don't think, ooh, I have to eat like this for the rest of my life. This is just soul crushing, especially to an addict. It's, ooh, but I can do it for a day. And then the next day you say, okay, I'm going to do it for another day and another day. Little steps, little attainable goals, doing the things one day at a time, and then allowing yourself to have these, I don't know, feelings, I think. Joining groups, working with other people who have the same struggles. Because then you know, all right, I woke up in the middle of the night and I had a candy bar in my mouth. Like, how does that happen?
Huh.
And then someone else says, I did the same thing. I woke up in front of the fridge and I had something, like I was eating something, I woke up. It's, you have confidence, you have peers, same struggles. You have accountability in groups too, if you want to. And also being immersed in the space, constantly hearing about it. And one thing I really want to let people know is moderation is not the key. Everything in moderation
Huh.
does not work for an addict. It works for many people, but not for addicts.
You know, it's interesting that you say that because we know that's true if you're an alcoholic. We know that's true if you've been a drug addict. But I certainly haven't thought about, I guess when I hear somebody say sugar addict, I've always heard the word addict in air quotes. You know what I mean? Like you're not really an addict like a heroin addict.
Hmm.
But talking about waking up with a candy bar in your mouth or standing in front of the fridge, that really does sound like that exact same kind of driven unconscious behavior. And maybe I need to adjust my thinking about the air quotes.
Yeah, this is something about addiction. It's not about willpower. It's
Yeah.
not about, it's the loss of control. So an alcoholic will find themselves in dire situations. It's not their choice. They're not choosing to be alcoholics, and sugar addicts are not choosing to be sugar addicts. It is an addiction. And there's this catalog of in DSM-5 of what is addiction if they eat despite it causing harm. So there's 10 or so criteria. And except for 2, like they all check the box for me. So getting this recognized as a substance of abuse would really help. Will that happen? I'm not going to hold my breath.
On the other hand, there's been things happen in the last 10 days. We are recording this about 10 days after Donald Trump was sworn in as president. And the things that have actually happened in the last 10 days that I thought I'd be booking my ski vacation in hell before any of these things happened. Who knows? Who knows?
Yeah, definitely so. I mean, we're, also as recording this, right, waiting to find out if RFK is going to be confirmed as HHS secretary. And he has talked about a lot of these issues around our food supply and our chronic diseases. We are certainly optimistic. What's next for Roxana? What else are you up to? And then maybe let people know where they can come find you.
Next will be the talk in Las Vegas. That's kind of like a highlight. I did talk at 2 events already, but this is going to be the biggest crowd. And after that, I'm now just enrolled in the Master Coach program. So there's going to be learning, helping people. I am kind of like thinking going back to school, but I'm not sure yet. I have to make the time. I do have my websites. It's reversing-insulin-resistance.com. And there's all my contact info there. There's also for people who want or are looking for coaching, they can find the information there. The information on the website is free. There's a link to my Facebook group and to my Twitter account. That information is free. I do publish a blog once a week. You were on that blog once. And yeah, if someone thinks they're a sugar addict, if someone thinks, okay, I know our food supply is messed up. I want to know how to eat right. Join my group, find more information, and it's all free.
Excellent. And the conference you were mentioning in Las Vegas in a couple of weeks, Dave Feldman's Citizen Science COSI conference, which unfortunately will be passed by the time this comes out, but Dave is great about putting the videos up on YouTube afterwards. Maybe by the time this comes out or somewhat after that, everyone will be able to check out your speech, which I'm sure is going to be great. I just want to say thank you. We didn't kind of touch on all the work that you have been doing a little bit behind the scenes to make the low carb conferences work. And it's always been great seeing you there. And you're always taking great pictures and videos to get
That's
up
pretty
on
much
social
all I
media.
do. I don't do anything else with those conferences. I just take the pictures.
Well, that's a big thing because that allows the message to get out there and to spread. It's been great seeing you step into that role and seeing you, grow over the years.
The website is reversing-insulin-resistance.com. I got that, didn't I?
You got that, yeah.
Reversing-insulin-resistance.com. Yeah. She is Roxana Soetebeer. What's the ethnicity? What is that? Netherlands?
I'm originally
German?
from Germany, and we moved here like 30 years ago.
Okay. What's it mean? What's it mean? Soetebeer.
So there's 2 translations. It could be sweet beer or sweet berry. It can be both. I'm going to go with sweet berry.
I was going with a bear from the South, but okay. All right. Roxana Soetebeer has been our guest. This has been Stay Off My Operating Table podcast with Dr. Philip Ovadia. All the contact information for our guest will be in the show notes. Thanks for joining us. We'll talk to you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com roxanasoutebeer.com/talk.